When I say the word hypnotherapy, what's the first thing that pops into your head? A swinging pendulum? Somebody on a stage? Well, today we're going to park all of that and look at this through a completely different lens. This is a clinical explainer drawing on some fantastic patient education insights from Dr. Praveen Ramachandra to really help us separate the science from the spectacle.
Right? This is the big question. Is it all about some kind of mysterious mind control like you see in the movies, or is it a legitimate, evidence-based tool that can be used in medicine? That's what we're here to figure out, and honestly, the answer might surprise you.
So let's start with the absolute basics. We've got to move beyond the stage show, beyond the entertainment, and get a clear, clinical definition of what we're actually talking about when this is used in a healthcare setting.
Okay, now the key words here are focused, relaxed state of awareness. This is not about being asleep or unconscious, not at all. Think about a time you were so lost in a great movie or a book that the rest of the world just kind of faded away. That's it. That's the exact kind of focused, natural state we're talking about.
And this is probably the single most important thing to understand. It's the biggest myth we need to bust right now. You are always, and I mean always, aware and in complete control. A therapist can't make you do anything you don't want to do. It's a collaboration, not a takeover.
So what does a session actually look like? Well, it's not some big mystery. It's a pretty clear, structured process. First, you'll just talk with the therapist. That's the assessment. Then comes what's called the induction, which is really just guided relaxation to get you into that focused state. The main part is the therapeutic suggestions, which are tailored just for you. And then you're gently guided back to full alertness, and you have a little chat about it. Simple as that.
All right, so we know what it is, we know what a session looks like, but here's the million-dollar question. Does this stuff actually work? Let's dive into the science and see what the evidence really says.
This number, 85, is a big deal. Why? Because it represents 85 separate randomized controlled trials. That's the gold standard in medical research. A huge meta-analysis looked at all of them and found, yep, hypnotherapy is an effective tool for pain relief. This isn't just a handful of stories, it's backed by a mountain of data.
And it's not just for pain, not by a long shot. The evidence is there for a whole range of issues. We're talking about things like managing anxiety and stress, helping with symptoms of IBS, even tackling certain phobias and insomnia. It's also used to help people quit smoking and to manage some of the really tough side effects of cancer treatments. It's a surprisingly versatile tool.
Now, this is a really crucial point. Hypnotherapy is not a magic bullet. It's not a cure-all. The research is clear. It works best as an adjunct therapy. That just means it works alongside your regular medical care, not instead of it. Think of it as another powerful tool in the doctor's toolbox.
Okay, so if there's all this science, why does hypnotherapy have such a weird reputation? Well, it's because it's been tangled up with some pretty wild pseudoscientific claims over the years. That's why learning to separate the clinical facts from the fringe fiction is so important.
When you boil it all down, the difference is pretty simple. The clinical reality, it's a tool for focused awareness and suggestion. The common myth, that it's some kind of mystical power for mind control or digging up past lives. You can see how these two ideas are worlds apart, and only one of them has any science to back it up.
This table really breaks it down for us. Look at the methods. One uses structured, evidence-based suggestions. The other talks vaguely about energy and mind control. Look at the evidence. One has clinical trials, the other has personal stories. But maybe the biggest difference is the practitioners. Clinical hypnotherapy is performed by licensed healthcare professionals. The other stuff? Often by people with no regulation at all. That's a huge difference when it comes to your health and safety.
So, now that we have a much clearer picture, let's get practical. How do you figure out if this might be a safe and helpful option for you personally?
Safety always comes first. And the good news is, when it's done by a trained professional, it's considered very safe. Side effects aren't common, but it's important to know they can happen. They're usually mild and pass quickly, things like feeling a bit dizzy or tired or even having a headache. Being upfront about this is just part of good medical care.
But, and this is a big but, it is not for everyone or every condition. There are specific situations where it's generally avoided or needs to be handled by a specialist. This includes things like psychotic disorders or uncontrolled epilepsy. This is exactly why a proper medical assessment beforehand is non-negotiable.
This might be the most important takeaway. If you're going to explore this, you have to find the right person. You're looking for a licensed healthcare professional, a doctor, a psychologist, someone who also has certified training in hypnosis from a real institution. Ask them about their experience with your specific issue and make sure you feel comfortable and that the goals are crystal clear from the start.
So, when we strip away all the myths and the stage show drama, we're left with a structured, evidence-supported tool. It's something that can be a really valuable part of a bigger health plan. It's not about losing control at all. In fact, it's about gaining more control by tapping into your own mind's ability to focus. Which leaves us with one final thought to consider. Could a focused mind be your new ally in health?